My name is Jo Poolman, and I am a registered nurse. And at AXA, I manage a team of nurses, pharmacists, midwives, and counsellors on a 24/7 health support line. An NHS Health Check, sometimes known as an MOT, is a free checkup of your overall health. It's predominantly looking for possible signs or risks of heart disease, stroke, kidney disease, or diabetes. They're the four main things. You should be eligible for an NHS Health Check if you're between the ages of 40 and 75. I should stress, though, that it's a checkup to understand risk, and you wouldn't therefore be invited if you already were suffering from any of those particular four main diseases. So heart disease of any kind, or problems with your heart rhythm, if you've had a stroke or recognized problems with your kidneys, or you've already been diagnosed with diabetes. If you fall into any of those categories, whilst you wouldn't necessarily be invited for one of these free health checks, I would expect that you would be being checked up on regularly anyway. In some areas, you might get a routine invitation from your GP surgery, but you might find that you need to contact them to see whether one is on offer and how you go about booking it. You might find that such a check is now available through your local authority, at the council, or even at one of your local pharmacies. So do go in and ask the questions if you haven't received an automatic invitation. The health check will be conducted by one of a number of different healthcare professionals. At the GP practice, it's most likely to be a nurse, could be a healthcare assistant. They will ask you a number of questions, which is the first step really to understanding your own personal risk. They'll need to note your age, gender, and ethnicity. They'll be very interested in your family history of any of those conditions that they're looking to potentially detect. They'll ask you questions also about some of your lifestyle. So that's, for example, do you smoke? And if so, how much? Do you drink alcohol? If so, how much? What is your diet like? And what sort of physical activity you do? How much, how often? And then they will do a number of physical checks. These are likely to be height, weight, waist measurement, blood pressure. They'll check your cholesterol. Those are the main things. The check can take somewhere normally between 20 or 30 minutes. There'll be plenty of time during that health check to discuss your particular worries. I would urge you not to worry that you're going to be criticised in any way, that the doctors and the nurses at your surgery, they want to help you to identify what your risks are with your diet, with smoking, with alcohol, if those are issues. And I would hope that you would leave that consultation with a much better understanding of where you are and what you can do where necessary. You should get your results during the appointment, during the consultation. They should be able to do some calculations and give you your own risk score. So that's often called your cardiovascular risk score, based on all that information they've collected. What is your own personal risk over the next 10 years of developing any heart disease, or developing any kidney disease, and so on. There are so many options now, anything from sending off for something in the post that will perhaps make you do a finger prick test. You can book a private health check through a private provider. You may find that's quite a lot more detailed and a lot more thorough, but the intention is the same. And often with those types of health checks, they will then link in with your GP. And you may, of course, have private medical insurance, and you might want to contact them to see what is available on your plan. It's well worth doing, because some of the things that might be found could be detected really early, and you won't be feeling any signs or symptoms or effects of them. But things that are found early, like a slightly raised blood pressure or a slightly raised cholesterol or blood sugar, It gives you lots of time to make changes, to consult with your doctor if necessary as to what you might do about them. It's about prevention, and in the end that gives you back some control over your health and your risks in the future.